Hi, I'm Jackie Keenan. In Chicago Business Today, profit discrepancies at hospitals. Smaller hospitals around Chicago are feeling deep recessionary pain, while the bigger medical centers are financially healthy. Northwestern Memorial Healthcare, for example, tripled profits from operations from a year earlier. Mount Sinai Hospital on the near west side, meanwhile, saw fewer patients and its operating income drop by 60%. Crane's managing editor Brandon Koppel sat down with senior reporter Mike Callias to talk about the causes for the discrepancies.
Mike, you report this week some pretty eye-popping numbers. Operating profits at Northwestern Memorial tripled last year to almost $100 million. NorthShore University Health System, Advocate, all showing 50% or more gains in their operating incomes. How is this possible?
Well, it was a little surprising to take a look at the numbers just because you've heard a lot over the last 18 months about hospitals, especially in this time around in the recession. A lot of times hospitals have done okay in downturns. This last one has really hurt a lot of places. You've seen volumes go down as more people lose their insurance. They put off getting procedures, and that's hurt revenue, a lot of profits, and a lot of places have seen.
But obviously not at the high end.
So that's what we found is the big places have held up really well and actually continue to grow, and I think there's a few reasons for that. I think one, their management teams, I think, moved a little more quickly than a lot of places. You know, they're big places with some savvy management in place, and they've been able to sort of get ahead of it a little bit. That's one factor. Another one is just brand power. These are the places that have been able to, pour money into their facilities and their equipment. Patients want to go to those kind of places, and if you're battling for a smaller pool of patients who have insurance, those things matter.
And you're talking about they've poured money into new facilities. And then the equipment you're talking about is for procedures that are really expensive and really profitable, right?
Sure, yeah. I mean, the focus at a lot of these places, both big and small, are the ones, the ones that turn out the most profits. I mean, you're talking about orthopedic surgery, so hip and knee replacements, which is an elective procedure, and that, you see pressure on that during a downturn. Cardiac surgery, neurosurgery, any of those things, those are profit centers at hospitals, and the big places drive the most volume, tend to do it best, and have kept their numbers up partly because of that.
There's kind of a spiraling effect here too, right? Because if you're a poor hospital and your revenues are down, your profits are down, it's hard to invest in that stuff, which makes it hard to then lure those kind of patients. And at the same time, the rich keep getting richer, as we said, and can keep investing more and more, right?
That's right. And I mean, that trend's gone on for a long time, and,
right.
and it's certainly true of the smaller city hospitals that you see a lot of uninsured and Medicaid. The interesting thing now is, a lot of the suburban hospitals that have traditionally been sort of financial powerhouses have been hurt by this recession too. I mean, you've seen a place like Northwest Community in Arlington Heights actually lost money on operations for the first time in a long time. Places like Edward Hospital and Sherman Hospital out in the western suburbs have seen declines in their patient admissions. That hasn't happened, and I think the thinking is, and these are places that have invested in their facilities too. I think the thinking now is that you're going to need so much scale based on whether or not health reform comes. I think there's a demand to squeeze costs out of the system. The bigger players are the ones that can do that best, and so I think a lot of people look at the Chicago market, which is very fragmented. There's no dominant one player, and see it ripe for consolidation. Even these bigger, sophisticated suburban hospitals might end up pairing up with, a Northwestern and Advocate and NorthShore, much like Lake Forest Hospital just did with Northwestern.
Well, I was going to say, we've seen the big downtown hospitals, as you wrote about last week, making inroads in the suburbs.
That's right.
Rather than just waiting for patients to come to them. They've been going out there and competing for those. And so I think we could see more of that as we go?
Yeah, I think so. I think that's going to be a trend of the academic hospitals that have traditionally just relied on their hub campuses downtown reaching out, and also, but they'll be competing with big suburban systems like Advocate, which does have a few city hospitals too, NorthShore University Health System. I mean, those places have integrated. They've broadened their physician staffs, and they're doing the kind of things that you do to keep costs down. They're looking to grow too. So there's going to be, I think, in coming years, sort of a battle over who can find the most inviting prospects in the suburbs to try to expand their base.
Now, a few years ago, Chicago and Illinois hospitals were under a lot of pressure for not providing enough charity care, especially the ones that were throwing off a lot of profit. With numbers like this now coming out there in the midst of a raging recession, do you think there's a chance that those issues could come back? They've sort of faded in the last year or so.
Yeah, I think that's always an issue. And some of the lawmakers and politicians who've made the most of that issue have been quiet in the last couple of years, really. Attorney General Lisa Madigan hasn't done much on that front recently. I think a lot of people are just waiting on this Provena decision, and that's the decision that's now in the hands of the state Supreme Court. They've heard the case, and they're going to make a decision on whether or not Provena had provided enough charity care at its Champaign Hospital. I think a lot of people are looking at that as a precedent setter in terms of, is there a sort of bright line as to what hospitals should be setting aside for free care or isn't there?
Okay. Well, thanks, Mike.
And that's all for this edition of Chicago Business Today. For more on this story, check out this week's print edition of Crain's or go to chicagobusiness.com. Thanks for watching. We'll see you tomorrow.